Hello, you're watching Health Day Now. In today's episode, we'll be exploring important issues related to maternity and pregnancy. We'll also be joined by the President and CEO of March of Dimes to discuss the risks that pregnant women, particularly women of color, still face in the United States. Later, we'll look at the risks that several types of hair chemicals can impose on pregnant women, and suggest several supplements that can be taken to prevent croup in babies.
Giving birth in the U.S. now costs nearly $19,000, according to a new analysis from the Kaiser Family Foundation. And expectant moms are responsible for paying a good chunk of that bill. Researchers reviewed claims filed from 2018 through 2020 by women enrolled in large employer health plans. The results showed pregnancy, childbirth, and postpartum care, on average, now cost $18,865, and the average out-of-pocket costs for patients total close to $3,000. Giving birth by C-section is more expensive than vaginal delivery, with even higher patient responsibility. The researchers say these bills are more than many families can afford. They say roughly 1/3 of multi-person households and half of single-person households would not have the liquid assets needed to cover typical out-of-pocket costs associated with pregnancy and childbirth in private health plans. One area where pregnant women were found to save money compared to other women is on prescription drugs. High blood pressure in pregnancy is on the rise, according to a new study, and researchers say Gen Z and millennial people are 2 times more likely to be diagnosed with the condition than baby boomers. The researchers looked at patterns of high blood pressure in first pregnancies among 38 million people from 4 generations. They found rates of hypertension during pregnancy were highest among more recent generations, regardless of their age. Participants who identified as non-Hispanic American, Indian or Alaskan Native, and non-Hispanic Black were most at risk. The researchers say a decline in heart health among young people and a rise in obesity may be driving this dangerous trend. The lead author says these findings highlight the need to broaden our perspective on screening and expand our focus on prevention in all age groups before and during pregnancy.
Hello and welcome to Health Day Now. I'm Mabel Jong. America is considered the most dangerous developed nation in the world in which to give birth, partly because maternal mortality rates in the U.S. have doubled over the past 30 years, while every other highly industrialized country has seen its rates decline. There are also blatant disparities. Women of color are significantly more likely to die due to pregnancy and childbirth than white women in this country. In a survey of over 2,000 adults conducted by the Harris Poll in partnership with Health Day, 75% of respondents strongly or somewhat agreed that there's not enough focus on healthcare for mothers after pregnancy and birth. To find out how our healthcare system can better protect pregnant women, especially women of color, we spoke to Stacey D. Stewart, the president and CEO of March of Dimes. But first, we heard from Dr. Sharina Walker, a hospitalist in Missouri, about what her healthcare experience was like when she became a mother. Dr. Walker, Sharina, thank you so much for being here.
Absolutely, my pleasure.
And congratulations. I understand you're expecting your 3rd child.
Yes, we are. Thank you so much. I'm really excited about it.
Well, tell me about the journey of getting to this point. You have 2 other children. Tell me about some of the health issues that you had and what you experienced during and after your 2 other pregnancies.
Absolutely. So we have a 4-year-old daughter. She was born during my residency. I was around 25 weeks pregnant. That morning I was fine. I started to have a cough. It got progressively worse. I do have a background history of asthma. So on my way from my home to the hospital, my symptoms got worse. I started to tire and they had to intubate me. I was intubated for 3 days, which was really hard for my family. That was my first pregnancy. We didn't know what to expect. We didn't know, what was going to happen. So after that, I came out of the intubation. The baby was okay, but it did cause a lot of worry, will this happen again? But we had a conversation, my husband and I, like, do we want to have more children? Do we want to potentially go through this again? So again, talking to our healthcare team, my OB-GYN, my pulmonologist. At that time, I did not have a cardiologist, to see if it made sense for us, weighing the risk and the benefits. And so for us, we felt like we had more love to give, and we trusted our team. So we had tried again. We got pregnant with our baby boy. I don't remember exactly what week we were in, but I was having some shortness of breath. At that time, they diagnosed me with RSV. I couldn't walk maybe like 10 feet without being hypoxic. My oxygen levels were in the 70s. And so I was admitted to the ICU. And from there, they did everything they could, and they did an echo. And at that time, they found out I had a PFO, which is a small hole in your heart. And so that's what led to me following up with a cardiologist. That's what led to the further care. That remainder of that pregnancy was fine. I didn't have any postpartum symptoms, but that also led to me broadening my team to make sure that, all my health issues are addressed if we were to have kids again.
Okay. Now you are pregnant again, but that wasn't until after you lost another baby at 7 weeks.
Yes. So that was a very hard experience for me. And so I met with the team to tell them I wanted to have another child, to prepare. And so we talked about the cardiology version of it. We talked about the pulmonology aspect of it. So I have a pulmonologist as well, the OB-GYN, and everybody. We got the clearance. We decided to try again. 7 weeks after that, I had this intense pain while I was working. I did go to the hospital I was working at that time. And at that time, the abdominal pain was lower and it kind of radiated into my perianal region. And so they diagnosed me with hemorrhoids. I did not get an ultrasound at that time. You would expect that I would have more background and more knowledge to talk about, what I needed at that time, but I was in so much pain. At that time, I wasn't a physician. I was a mom. I was a patient, and I just needed someone to advocate for me, someone to dig a little deeper. Because I couldn't voice anything. I was just so focused on trying to get through. And so I was discharged with the diagnosis of the hemorrhoids. The next day, I couldn't get off the floor. I couldn't get off the floor. Any movement, any driving, anything that caused my abdomen to shift caused me severe pain. So I went to the hospital that I'll be delivering at with my team. But again, my voice wasn't heard as much as I would like it to be. So for hours, I sat there in pain. And eventually I got back there, but that's when my team sprung into action. And so they did the ultrasound and they found that I had 2 liters of blood in my abdomen. And they immediately took me back to do a surgery. And that's at that time, they found that I had intra-abdominal pregnancy, and we did lose the baby.
Based on your interactions with the healthcare system so far, what do you think are the factors responsible for the disproportionate numbers of pregnancy-related complications and deaths among women of color?
I think there's a lot of factors, but I think the one most immediate factor that can be addressed is just allowing our voices to be heard. If I'm saying that I'm in pain, I have a high pain tolerance, but if I'm telling you that something's wrong, let's look beyond hemorrhoid diagnosis. Let's look into something else that could potentially be wrong, because this could be life-threatening for me. And as a physician, but more so as a mom, what I want is I want to be safe. And I want to be able to make it home to my husband and my kids. I want to see them grow up. I don't want this to be the end while I'm trying to bring life into the world. I just want to enjoy my blessing of having another child. And I think that's heartbreaking in that we have to think about that. We just want to, have our voices heard and have our babies. But we have to think about all these conditions and, complications that could happen.
Thank you so much for that, Sharina. Stacey, I'd like to bring you in here. Stacey Stewart, President and CEO of the March of Dimes. Stacey, maternal deaths have been steadily rising in the U.S. since 2000, and it's shocking to most people that the maternal mortality rate in this country is significantly higher than other developed nations. What would you say are some of the main factors responsible for this?
What Dr. Walker talked about, unfortunately, occurs far too commonly in the U.S., especially for Black women in this country and other women of color. Today, we are considered the most dangerous developed nation in the world in which to give birth. And Mabel, it's partly because of what you just talked about, the fact that our rates in the US of maternal mortality have actually doubled over the past 30 years, where in every other highly industrialized country, their rates of maternal mortality have been declining. Our rates have been increasing. So we are unique and in a very, unfortunately, distinguished, not in a positive way, position in the US of really failing far too many moms and babies, and especially moms and babies of color. We know Black women and Indigenous women are significantly more likely to die as a result of pregnancy and childbirth as compared to white women in this country. And there are a number of reasons for it. We obviously have access issues. You know, the March Times did a study some years ago. We started in 2018, updated in 2020, and we're in the process of updating it again. A study looking at maternity care deserts, where we know that in 54% of all the counties in the country, there is little to no access to obstetric care for many women. We still have 15% of women in this country that go without any adequate prenatal care in this country. And again, especially true for women of color. But when we look at the issue of maternal mortality, it's really important to look at something that Dr. Walker mentioned, which is heart health. Cardiovascular conditions actually are the biggest contributor to maternal mortality in this country. So there's a strong connection between heart health and pregnancy related complications, childbirth related complications. We know that there are other risk factors, not that it causes maternal mortality, but risk factors related to maternal age. We know that a woman that is at a higher age, if she's older, especially from 35 to 39, she's probably twice as likely to experience a maternal death as compared to a woman in her early 20s. And again, we have to look at the issues of how women live. Most of our health is determined not by what happens in the doctor's office, although I will tell you that about 60%, according to the CDC, of all maternal death could be avoided by doing some of what Dr. Walker wishes she had experienced: a timely diagnosis, a responsive diagnosis, being listened to, being heard, being respected. But what we do know is that, you know, a lot of the issues around maternal mortality and our health overall really have to do with how we live. In fact, 80% of our health is really determined by how we live, whether or not we have access to safe, decent housing, good nutrition, access to good care, and all of those things. And unfortunately, because of the effects of racism, far too many women of color are living in conditions where they may not have access to the highest quality housing, highest pay, to deal with their economic and financial issues at home. Really, all of the issues that really determine how we live then have an effect on our health, then have an effect on the results of our pregnancy and childbirth, whether or not we survive it and whether or not our babies survive as well.
Okay. And what about insurance coverage for pre and postnatal care? How does this directly impact the health of the mother?
So Medicaid covers over 40% of all the births in this country. It's a huge component of the issue of whether or not women before they're pregnant and certainly during pregnancy and childbirth have access to be able to afford the care that they deserve to have. We know that in this country, if you are able to get on Medicaid for pregnancy and for childbirth, too often many women are dropped from that coverage, that Medicaid coverage, 2 months after having a baby. So one of the things that we are doing at the March Times is advocating for extending Medicaid at least 1 year postpartum. 1/3 of all maternal deaths happen 1 week after the baby is born out to 1 year. So if women are being dropped 2 months after the baby is born, that means they may go without the care they need. If they have had a difficult pregnancy and childbirth, if they have extenuating health circumstances and need to be seen by a physician, by a doctor, they need to have the coverage in order to afford that and pay for that. So insurance coverage is a big part of it, but that's only one part of the overall picture that we have to address.
Okay. Just want to get back to the data for a bit. The CDC has been criticized for only including deaths that occur within 42 hours or 42 days, I'm sorry, of delivery when tracking maternal mortality rates. Do you think it's important to track deaths outside of that 42-day window?
Well, I think one of the things that we know is that maternal deaths do happen much further out than 42 days. And there are other places around the world that actually do monitor deaths out 1 year. We do believe that it's very important to look at 1 year from when the baby is born, because those issues of any health challenges that a woman may be experiencing and that may have exacerbated even during her pregnancy and childbirth experience, could continue for a longer period of time. It's also why we're looking at extending Medicaid coverage again out 1 year to make sure that a woman has adequate time to see after her own health.
Dr. Walker, you work as a hospitalist, and most people would say you are in a strong position to advocate for what you need. So what's the advice that you would have for other moms? I mean, if you as a physician are having a hard time to have your voice heard, what's the advice do you give to other people?
Listen to your body. Don't be afraid to try to say what to say how you feel. If it's a concern, if it's something that's unusual for you, let's talk about it. Make sure you have a good relationship with your team. And for me, that's what gives me comfort. As I'm on my third baby, like having a good relationship, a close connection that's saying like, hey, I need you to look into this. At that time, things in our relationship has progressed since this summer. But I need you to look into this. This is really concerning me for them to hear me and say like, if it's concerning you, then it's concerning me. Let's talk about it.
Yeah. All right. Well, Dr. Sharina Walker, best wishes to you. Really.
Thank you.
Thank you for your time today. And also thank you for your time, Stacy. And we look forward to seeing you in the future. And thank you, Stacy D. Stewart, the president and CEO of March of Dimes. I'm Mabel Jong. You've been watching Health Day Now.
Chemicals contained in certain personal care products may impact hormone levels in pregnant women, a new study finds. Researchers say the chemicals, such as phthalates, parabens, and phenols, interfere with hormone systems that are especially vulnerable during pregnancy. More than 1,000 pregnant women in Puerto Rico underwent physical exams and completed questionnaires about the use of skin lotions, cosmetics, nail polish, fragrances, shampoo, and other hair products. The participants also had blood samples taken twice during their pregnancies, which were analyzed for 9 sex and thyroid hormones. The results showed the use of hair products, particularly dyes, bleach, relaxers, and mousse, was associated with lower levels of key hormones that help maintain pregnancy and encourage fetal development. The researchers say disruption of these hormones may contribute to growth restriction, preterm birth, and low birth weight. The lead author adds, alterations in hormone levels, especially during pregnancy, can have vast consequences beyond health at birth, including changes in infant and child growth. The researchers recommend that physicians and obstetricians speak to women of reproductive age about the potential health effects of endocrine-disrupting chemicals like those found in hair products. Pregnant women who take fish oil and vitamin D supplements may lower the risk of croup in their kids, a new study finds. Croup is a common chest infection that can cause difficulty breathing and a barking cough. The study included 736 pregnant women who were divided into 4 groups and given varying doses of vitamin D with either fish oil or olive oil. The participants were asked to take the supplements daily from the 24th week of pregnancy until 1 week after giving birth. Researchers then followed the newborns until they were 3 years of age. They found the risk of childhood croup was 38% lower in the fish oil group versus the olive oil group, and 40% lower among kids whose moms took high-dose vitamin D versus the standard dose. Although more research is needed to determine exactly how vitamin D and fish oil help prevent croup, one author says it could be that they can stimulate the immune system to help babies and young children clear infections more effectively. He says these supplements could be a very cost-effective way to improve children's health.
Thanks for watching Health Day Now.